This program and its contents are designed for information and educational purposes only. This program does not render medical advice or professional services and is not intended to be a substitute for professional care. The information provided here should not be used for the purposes of diagnosing or treating a medical or psychiatric condition. If you have or suspect you may have a health problem, consult your healthcare provider.
Welcome back to Positive Momentum TV. I'm Diane Silva, and we have Dr. Scott from UNO and Boys Town. And we're going to continue our conversation on flight, fight, and freeze. And Dr. Scott's going to discuss
rest and digest.
Thank you.
So if we think of fight or flight as the sympathetic nervous system, sympathetic, it means it kind of feels sorry for you. You're in a situation and it doesn't want you to have to suffer it. It wants you to get out of there.
Right.
The opposite side of that is the parasympathetic side. It's, if we call the sympathetic side fight, flight, and freeze, we call the parasympathetic side rest and digest.
Okay.
It's calming. And these are things that we can do that quickly and immediately trigger that rest and digest side of our bodies. And our brain is wonderful. We can easily trick it.
Yes.
So we can trigger it off the one onto the other.
Well, if we can trick it into being afraid, we can trick it into being not afraid.
That's right.
Any more than we can trick it into being, oh, I'm sick, or I'm well, I refuse to. So yes, I've had those experiences. So yes, I've seen people do it.
Sure. And while some of these things that people want to do when they feel fight or flight maybe would be embarrassing, some of these are very easy to do.
Okay.
Not going to call a lot of attention to yourself.
And that's good, because we already feel like we're in the big spotlight, and everybody's heads are turning, watching us.
So when you experience fight or flight,
mm-hmm.
your body starts pulling all of the blood to the vital organs,
okay,
and to the muscles. It wants to be ready,
right,
to fight whatever it needs to fight.
Okay.
You can actually measure that difference in your hand temperature over about 5 minutes. Have you ever been in a store and you see the little cards that are color sensitive? You put your thumb on it and it tells you how stressed you are?
Yeah, it's almost like a mood ring, but a mood card.
A mood card, exactly. What it's doing is it's measuring the temperature of your hand, because
okay.
when you're stressed, the blood comes in, your hands get colder.
Right, okay.
So anything we do with visualization around the idea of warming our hands.
Okay.
So if you're sitting in the dentist's chair, and that's a particular trigger for you, I don't know if it is.
Yes, it is. Quite
but
much.
if it
Yep.
is,
Mm-hmm.
and you can sit with holding your hands in your lap and imagining a cup of coffee, a cup of hot cocoa. Anything you can do to visualize that and warm your hands,
Ooh.
that's going to trigger that parasympathetic side, that rest and digest side.
Well, I'm doing it now, and I'm feeling a difference.
Right, and if you had one of those little mood cards, over the course of about 5 minutes, you can actually measure a 2 to 3 degree temperature change in your hands.
Wow.
Simply by visualizing that.
Wow.
For some people, it's just a matter of finding the right piece to visualize.
Okay.
So the cup of coffee, the cup of hot chocolate tends to be a very calming thing for people anyway.
Right.
So that's kind of a nice one to use. Some people love hot showers.
Yes.
The idea of sitting there in the dentist's chair and imagining yourself in a nice hot shower.
Okay.
Or having just washing your hands with nice hot water.
Okay.
That's another one of those tools that you can easily use.
These are wonderful, and like you said, nobody can tell that you're really doing it. You're just kind of sitting there calmly, and at least on the outside, you're calm. Mm-hmm. Excuse me.
It's even more powerful if you can start to bring in elements of the breath.
Okay.
So people who practice yoga will tell you that the breath really controls the emotions.
Okay.
That if you can control your breathing, you can control your emotions. So as you're doing that visualization, start really focusing on your breathing. And some simple ways of doing that that we can demonstrate right now. One that I like to call elevator breathing.
Okay.
Most people think of deep breathing, and they don't know, well, how deep do I go? The whole bit.
Right.
So in elevator breathing, what you do is you start breathing in to the count of 1, and then breathe out to the count of 1. The next time you're going to breathe in to the count of 2. So it goes a little bit deeper, and out to the count of 2. Then you go to 3, and you progressively go further and further. Myself, personally, I find about a count of 7 is about as deep a breath as I want to go comfortably, but then I count back out with that 7. And then the elevator has to come all the way back down to the ground floor. So once I'm at 7, my next breath is going to be to 6, my next to 5, and I bring it back down again.
Oh, that is really cool.
So if you can do that kind of elevator breathing right along with that visualization, or if it's not, maybe you actually have a cup of hot chocolate or hot coffee that you can hold around in your hands while you do that breathing. And you can bring those two pieces together.
These are wonderful techniques, and again, remind everyone, if you do these on a normal basis, whenever you think about them, it's better to do it that way, and then it becomes part of your automatic responses.
Right. You want to practice these as many times as you can. If you have a cup of coffee every morning, it's a natural time to sit down, and maybe you only practice your elevator breathing to the count of 3, but still you're practicing it so that it becomes natural and routine, so that when I need it, not only do I think, here's a tool I can use, but it's a natural tool to use.
And these are so helpful, and yes, I plan on, my husband came out, we need to remember to do these. Yeah, well, yeah, you think? I know I do, especially, people get stressed, we become anxious, maybe just fearful, whatever that keeps us outside of our calm. And, I'm trying not to use labels, because not everybody knows what anxiety is or fear is, and it's individual.
It's different for each person.
Right, and it's so individual. So my point is, when you're not in your calm place and you're not feeling yourself or comfortable, this is when is a good time to use these tools, correct?
Right. Some of these you can use at a red light.
Oh yeah, in traffic.
You're heading into a stressful meeting. Maybe traffic is stressful.
Got an exam at school.
Right. You can do many of these right on your way to work or school or wherever you're headed, the dentist's office, the airport.
Yeah. Okay. Yeah, those are good places.
Yeah, those are all good places for most of us to use them.
Yeah, even if you don't have true anxiety, any kind of, like you said, and I can't stress enough, just the practice of doing things. Everybody says, oh, this is hard. Anything is hard when you're first learning to do it. Think of the child learning to walk. Think of, even just learning to crawl.
Yeah, learning's hard.
Learning is hard, which is what we're going to kind of go on in our next, when we come back. So do you have any maybe last minute on this one segment?
Yeah, when we talk about breathing, there's ways that we can incorporate other physical features, mainly our mouth. So people are used to deep breathing, but if they can trigger this idea of pursing their lips when they breathe out, it makes noise. If they're making noise as they breathe out, they're also triggering a nerve that runs right along here, the vagal nerve, that's a natural relaxer. That's why we give babies pacifiers. It's why people like to smoke, in addition to nicotine. But that's the relaxation component that we can easily build in to breathing.
Well, thank you very much, Dr. Scott.
My pleasure.
This has been wonderful information. I'm hoping it's helpful to everyone out there. I know it's helpful to me, and I plan on using this and start practicing as soon as I possibly can. Thank you very much.